YKD 9210 4K medical endoscope camera system contains 4K monitor series, video processor YKD 9210, camera head, light cable, preparation before use. Check camera head, remove the dust cover. Check the camera lens for dirt. Wipe clean with white gauze. Check the camera cable. Check the camera cable for abnormalities. Check rigid scope. Carefully take out the rigid scope to prevent collisions so as not to damage the rigid scope, and check the appearance for abnormalities. Finally, observe the scope with the eye to see if there is any dirt, such as stains, and wipe it off with shoulder and absorbent cotton. Check whether the light is good. Intermittent obscuration of the objective end. Observe whether the light and dark changes at the interface of the light guide are normal. Check light guide. Check the light guide in the same way. Connect the light guide. Connect camera. Pinch the front. The red dot is inserted relatively straight. When pulling out, pinch the front end and pull out backwards. Do not shake left and right. Connect the rigid scope. Rotate the camera coupler to connect the rigid scope. After connecting, pay attention to the anti-lock coupler. Lock the telescope and avoid the rotation of the rigid scope. Connecting the light guide to the scope. Rotate the beam guide nut to attach to the scope. Turn on the power switch. Power on. Press the power button of the 4K video processor. White balance. Aim the scope at the pure white gauze. Make the monitor full screen white. Press the camera white balance button, or press the white balance button from video processor. A white balance complete prompt will appear on the lower left of the monitor, indicates that the white balance operation is complete. The camera has a white balance memory function. No need to white balance again without changing the scope. Video recording demo. Insert U-disc. The lower right corner of the monitor prompts USB status idle. Press the camera record button, or press the video button on the video processor. When recording, the lower left corner of the monitor prompts recording. Please do not plug or unplug the U-disc. The right side prompts that the USB status is recording. Press the record button again when finished. The lower left corner of the monitor prompts the video is being saved. Please do not unplug the U-disc. The right side prompts that the USB status is being saved. Wait until the bottom left corner of the monitor prompts the video has been saved. You can eject the U-disc, then pull out the U-disc. Picture capture function. Press the camera button on the camera head. The lower left corner of the monitor will display successful capture. Intraoperative points. The length of one arm is reserved for the guide beam, which is convenient for moving the scope during operation. Surgical scene switch. According to surgical needs, surgical scene switching can be performed on the video processor. The 4K video processor has built-in 5 surgical scene modes. Before the operation, please select the corresponding operation scene according to the operation needs. Click the next page to adjust specific parameters such as hue, brightness, contrast, etc. Restore the original parameter settings. Click the reset button, and finally click the home page to return to the main menu. Zoom adjustment. Zoom adjustment. Adjust image zoom in and out. Focus adjustment. Adjust image clarity. Prevent intraoperative fogging. To prevent fogging during the operation, scald the scopes with 60 degrees warm water for more than 10 seconds before the operation. When wiping the scope during the operation, wipe the surface of the objective lens with shoulder gauze. Post-operative cleansing. Light guide cleaning. Wipe the light guide with alcohol-soaked gauze. Camera cleaning. Clean the camera in the same way. Scope cleaning. Clean the tube and remove the light guide interface nut. Wipe it clean with alcohol gauze, then tighten the nut. Sterilization method. Rigid tube scope. 1. Pre-vacuum pressure steam. 2. Ethylene oxide. 3. Low-temperature plasma. It is not recommended to use glutaraldehyde solution soaking method for sterilization, leading to aging problem. Precautions. The camera cable is placed in a large circle with a diameter of not less than 20 centimeters and a lens protection cover is added. It is strictly forbidden to take the camera by pulling the video cable. When the light guide is stored, the disc is formed into a large circle with a diameter of not less than 20 centimeters.